Welcome. I am Dr. Norman Johnson. I am grateful to the Academy of Orthopedic Physical Therapy for the opportunity to present the Mobility Assessment and Treatment Device with Clinical Utilization Method, recipient of the 2024 Fourth Quarter Innovative Practice Award. Objectives: review the history of the four-square step test, the figure-of-8 walk test, and the timed up and go test. Discuss the limitations of performing the four-square step test, the figure-of-8 walk test, and the timed up and go test compared to the innovative mobility assessment and treatment device. Discuss the clinical therapeutic activities performed by utilizing mobility assessment and treatment device. Discuss relevant legislation supporting fall screening and how to identify and locate your U.S. representative and U.S. senator. Discuss why advocacy and increasing the utilization of fall screening is important. 3 questions for today's presentation. Are you familiar with the four-square step test, figure-of-8 walk test, and timed up and go test? Do you use the four-square step test, figure-of-8 walk test, and timed up and go test? Are you open to learning about using the mobility assessment and treatment device to perform the four-square step test, figure-of-8 walk test, and the timed up and go test? The mobility assessment and treatment device, as shown here, is made of high-quality projection screen material called matte. And this material, when you put black paint to outline it, lends itself very nicely to videoing your patients as they ambulate across it. You see the markings. If we start from the left side, you can have where the chair is seated for the timed up and go, and you can see the 10-foot mark, or if you use meters, across from it is the 3-meter mark. And then right in front of it is the pattern for the four-square step test. And then we have dots at 2.5 feet apart, the black dots, and those can be used for the figure-of-8 walk test and also for serpentine cone placement as a therapeutic activity. Research for the assessment dates back to 2000 with Anne Shumway Cook, Sandy Bauer, and Marjorie Willicott. What they looked at was populations of followers and non-followers, and they found out that through the timed up and go test, the cutoff score was 13.5 seconds to have both sensitivity and specificity at 87%. Taking longer than 14 seconds to complete the timed up and go indicated a high risk for falls. Noteworthy is adding a secondary task, such as carrying a cup full of water by the handle, did not increase the ability to predict falls. Another study by Dite and Temple in 2002 looked at changing directions and stepping, and this resulted in the four-square step test. And what this did is compared 3 groups, multi-followers, non-followers, and a healthy group, and they did a pattern where you stepped forward to the side, back to the side again, and then repeated that. And the study found 13 seconds as the cutoff resulted in a sensitivity of 89% and a specificity of 93% for predicting falls. Changing directions continued to be a form of assessment, and walking skills can be assessed in older adults. The validity of the figure-8 walking test, and this was done by Hess and colleagues in 2010. And what they looked at is a 5-foot pattern starting in the middle at 2.5 feet and walking up and around the cones, then making a figure-of-8. And what they looked at was both the speed, how long did it take to complete it, the amplitude, how many steps were taken, and the accuracy. Did they stay within that 2 foot on the right and 2 foot on the left zone, or did they deviate out of that 2 foot boundary? The mean time for that was 10.49 seconds. The study did not determine norms or reference values. The value of the study was it took a single turn and then looked at a curved path walking where With a single turn, it's one task, where with the curved path, you have both clockwise and counterclockwise turns. With the timed up and go, the person who you were assessing could turn to their stronger side. With the figure of eight test, now the person had to turn to both left and the right, so they no longer could hide a weaker side. The International Classification of Functioning Disability and Health, or the ICF model, the domains here are body structure and function, and the ICF categories are mobility, walking, and moving around. And the activities under Section D are mobility, and you have subcategories for walking and moving around. Walking is a functional activity that develops between 10 to 18 months after birth and is constantly used throughout a lifetime. Here we demonstrate the clinical assessment uses of the innovative mobility assessment and treatment device. In the bottom left-hand side, you see the 4 square step test with a 13-second cutoff. You see an Medicare eligible female here finished that test, did not hit the tubes that project about an inch in the air, and that would be a normal test and probably gets us in under the cutoff score. In the center, we have the same female do the walk test, and you can see as she goes through very smoothly, very fluidly, she did not stop. She completed the test, and again, probably hits right around what the mean completion time is. And then on the right side, we see the timed up and go test. And on my command, she started. She goes up, makes a nice smooth turn around the cone, back to the chair, turns, pivots, grabs a chair, sits down, and again, she's probably within the cutoff time. This compared to the next two tests we'll show you. Here we have a gentleman that had a stroke, and on the left side, you can see him doing the figure of a walk test, which is commendable that he's doing it. And you see that he does it much slower. And you also see when he does the turns, how creative he is using the quad cane to help facilitate those turns and maintain his balance. You can see much more concentration on his part. Looking down at the surface, you can see he's kind of outside the 2-foot border to the left and the right. But the key thing is he is doing it successfully. And as he rounds the turn for the last cone there at the bottom, and he's coming down the last 2.5 feet, again, you can see he has a very wide base of support, helped with the placement of the quad cane. And again, you see how creatively he is to come and use his wide base of support to get to the end. His time was considerably more than the mean time for the figure of eight walk test. Here we have the same gentleman doing the timed up and go. You can see that on command, he was able to rise from sit to stand, carefully then grabbed his quad cane, and you can see him heading down the path. Again, you can see a very wide base of support. You will see that he actually takes and puts the cane around the cone, then brings it back in front of him, turns again, and again, this is all to maintain his balance and to continue going. You see he definitely is outside 2 foot to the left and the right. So handicap width sidewalk of 48 inches, he would definitely need all of that to stay upright. He does get back to the chair. He does a nice pivot turn here, and then he turns, will reach back and grab the chair and return to the seated position. Again, his cutoff score is much higher than the norms that were established. But again, we would anticipate that. And again, we would anticipate that he is high risk for falling. And while we're looking at these videos, you can see how nice those were videoed with a camera phone. Here we have clinical application of the mobility assessment and treatment device. Here we're doing therapeutic activities. So what we've done every 2.5 feet is we have stretched out the orange cones. These are little 7-inch high cones that are used to mark kids' athletic fields, but you can get those very inexpensively. And we have our patient start. This can be a therapeutic activity. So we want to make this fun And once you have a little competition there, especially with the time of the watch, you go ahead and have the person go through. And this repeats the turns to the left and the turns to the right. We can do this then using cuff weights, or we can use a weighted vest to make this even more challenging and work on some strength building with the patient. If we look over on the right side, we have the patient doing the four square test. However, what we've done is we've elevated the tubes. The tubes are actually plastic sleeves for inside a golf bag. And traditionally, the four square step test was done with four wooden canes. People sometimes like to do the activities exactly as it was done in the original test. And also, people have gone to using a T and stuck four pieces of PVC to simulate the four square. Those both, if you ever stepped on something round and wooden, you can turn your ankle or you can even result in a fall. Here, if they step on a golf tube, it's plastic, it flattens it. And if they ruin it too much, you just get rid of it and get a new one. So I prefer those as a safety feature much, much more than I do the original wooden canes or the PVC. In this case, we're using the blocks here, mega blocks, or there's brand names to those blocks, but these sit about an inch and a quarter high. So you can now make it a challenge for the person to step over. Again, you can add cuff weights to the ankle, or you can add a weighted vest on to again build up some strength through this activity. Here's a couple more activities. We've taken the golf tube sleeves and we put them on the blocks and we've elevated those and we have the person actually step over them. Again, we've put them inside the four square column. However, that's just a close-up picture using the vest. So as good as your imagination is, you can come up with many activities here to challenge the patient. And the nice thing is you're using the same surface when you unroll it, and you do not have to put tape on the floor or the walls. Makes it very efficient for setup. Unique attributes of the innovation. The guiding principles behind this innovation are grounded in contemporary physical therapy, clinical practice, and research. The mobility assessment and treatment device allows for the following: the four square step test, the figure of eight walk test, the timed up and go test. This would be on an 11-foot mat. To do the dynamic gait index or the functional gait assessment, you need a 21-foot mat, which would also let you do the first three tests that we just discussed as well. Relevance of practice innovation to patient care and treatment. There's significant value in the established gait speed, balance, coordination, and mobility test norms when requesting treatment authorization, reauthorization, discharge planning, and establishing patient treatment goals and establishing their plan of care. The tests are efficient and can be administered in minutes. Furthermore, the same surface on the first visit for future visits for testing and for treatments is accurately replicated at each visit. Benefits and value to clinical practice. The mobility assessment and treatment tool provides a strategy to support stopping addiction and falls for the elderly, or SAFE Act, which is HR 1171, and it's under consideration here in 2025, as is the Safe Steps for Veterans Act, Senate Bill number 668. It was developed from contemporary literature and research. It contributes to reducing overall healthcare costs through falls risks and screening, reduces measurement error, provides objective data for Medicare G codes, provides an option to perform clinical therapeutic activities, provides testing measurements for assessment and treatment, reduces setup time whereby increasing efficiency, and it incorporates the U.S. Preventive Service Task Force recommendation. Here is an example of a functional mobility assessment template. Generally, these tests for mobility are done 2 to 3 times, and usually before and after you can take blood pressure, pulse, and the pulse ox. Earlier, I mentioned legislation, which I will now discuss. In 2024, two pieces of legislation were introduced to expand falls risk assessment. The Stopping Addiction and Falls for the Elderly, or SAFE Act, upon passage, would allow physical therapists and occupational therapists to initiate falls risk screening at the Medicare initial welcome visit, and then annually thereafter for the wellness checks. This results in early identification and intervention. In 2023, there are approximately 59.2 million people in the United States over age 65. On average, 10,000 people in the United States turn 65 daily. This number will continue to grow to 78 million by 2040, which would represent at the time 22% of the population. Also in 2024, the Safe Steps for Veterans Act was introduced with the intent to establish an Office of Falls Prevention within the Veterans Health Administration. The bill would also require annual falls risk assessment to be performed by licensed physical therapists or occupational therapists. This service would be provided to the 9 million registered veterans who receive the annual screening. The importance of legislation addressing falls and their early identification. The CDC reports falls are the leading cause of injury for adults ages 65 and older. Annually, over 14 million, or 1 in 4 adults, reports falling. Increased falls risk screening would help decrease healthcare costs, injury, and pain. The statistics support the passage of increased falls screening legislation, as does the low number of physicians for the populations as identified in the 2023 Brooks Rehabilitation, The Cost of Falling report. Inherent to the name physical therapy, we need to take action on behalf of our patients by improving access to falls screening. The profession of physical therapy is poised to seize this unique leadership opportunity. In 2022, $80 billion was spent on the treatment of falls after people entered the emergency department for care. If we take and look at the Medicare and Medicaid number, this was $56.8 billion. If we take and we look at the utilization of falls prevention through screening of Medicare and Medicare patients, a simple 5% reduction results in $2.84 billion. Whereas if we can cut that down by 25%, you can see on the chart is $14.2 billion. This money could be redirected toward research and reimbursement. How to find your U.S. representative and U.S. senator. The links below are very easy. You enter those in, you put in your zip code, and it gives you who your elected official are for your area. The two areas of legislation that I just presented are what I would call no-brainer legislation that should generate bipartisan legislative support. And remember, mobility matters throughout our lifetime. Thank you for taking the time to view this presentation. And a special thank you to everyone who contributed to the creation, demonstration, implementation of this presentation and the device itself. If you have any questions or comments, please feel free to contact me at mobilitymatterstous@gmail.com. Thank you.